On innovative health financing wrapped up in Johannesburg, South Africa yesterday, the 25th of September. And this was organized by the World Health Organization's Africa Regional Office and the Global Fund. The gathering brought together governments, development partners, and health experts to explore new ways of funding stronger, more sustainable health systems across the continent. To discuss the key takeaways and what they mean for the region, we're now joined by Dr. Omar Albush, Kenya's Director for Health Sector Coordination and International Affairs. Thanks very much indeed for joining us, and welcome to the program.
Thank you for having me.
In your view, what were the most significant decisions or agreements you think that were reached at the meeting in Johannesburg?
Yeah, I think we came with a common understanding that external dependence on external assistance has to end in Africa, and governments have to increase their commitment to funding health as a social service in the continent. So, what we did also is to looking at innovative public-private partnership within the continent that can increase resources for health. We learned about the Emerging Social Impact Bond implemented by South Africa, and also learned about approach to earmark tax that can be channeled towards the health sector in Africa. And also, most countries now are moving towards formation of a form of a national or social health insurance, including South Africa, that has just enacted one last year through the government of South Africa. So those are the main outcomes I can say that we are looking at as countries in sub-Saharan Africa.
How do you see Kenya adapting those ideas in its own context? What will change in Kenya's health financing strategy over the coming year, in your view?
Yeah, I think Kenya also is one of the most ambitious African countries in the health sector. We launched our social health insurance in 2024, which tries to really increase access, reduce out-of-pocket expenditure. And one of the things that we've learned from this meeting is the use of earmark tax, that you can channel additional resources from earmark tax. Rwanda has done that, and we've seen also Ghana did that, and we are looking at that as one of the options. Two is also looking at private sector investments to really crowd in more resources for health, local manufacturing, incentivizing private sector service delivery, and also using instruments, special financial instruments like bonds, to really bring in additional resources into health. So those are the lessons learned, and I think we are looking at exploring them in Kenya when I'm back. Thank you.
You talked about donor dependency and reducing that as much as possible. What do countries that genuinely just don't have the funding and the resources do? Because that funding was literally lifeblood.
Yeah, I think we know what happened this year, when the US government stopped the funding to most of the services in or most of the countries. And I think countries now are looking at using their tax funding efficiently to fund health, innovative way of increasing efficiency with the little money that you have, making it more efficiently used. And we've seen countries like Tanzania, like Zambia, Zimbabwe, looking at direct health facility financing, where the funds really don't disappear within the system, but they are taken directly from the National Ministry of Finance to the health facility where they are needed, frontline health facility where they are needed. So that means that there's less transactions in between, and more money going directly now to service delivery. And also other approaches that countries are looking at is really engaging the private sector, harnessing resources, existing or new resources, innovative financing approaches from the health sector. Private-public partnership, structures are being formed in countries now, and also, systems to encourage private sector investment. So really a shift from aid to trade, which is now, the common buzz globally. So that is also what the health sector is looking at, shifting more from aid and into really investment in the health sector. Thank you.
Is there room for regional collaboration and maybe harmonization? I'm thinking shared risk pools, cross border health procurement or coordination, and perhaps this might help in driving costs down and improving efficiency.
Yeah, exactly. And that is already happening, in procurement. A group of nations, they call themselves small island nations, have formed a procurement system. So you have Comoros, Seychelles, Mauritius, Cape Verde, coming into a common pool and trying to procure, together so that they benefit from the economies of scale. So that is something, and that is being done. The other thing is the regional bodies have taken up, accountability and sort of advocacy to really encourage governments and providing also technical assistance to help governments to think efficient ways of investing in health and also hold each other accountable for increasing investment in health. This includes the African leadership team. We have now at the AU a framework that is trying to hold each other accountable. We know SADC is doing something, also East African community also. We are doing something to really share experiences, expand procurement to increase the economies of scale and get better value for money, and also help each other to navigate the journey of national health insurance, which most countries are moving towards now.
Very briefly, looking ahead, what will success look like in 3 to 5 years' time for Kenya and across the continent, actually?
Yeah, I think starting for Kenya is that we have a social health insurance that covers at least 90% of the population. There's reduced, point of care payment or out-of-pocket payment for citizens. There's better quality of healthcare through the social health insurance. There's increased citizen satisfaction with the insurance and with the health services. And I think that's for Kenya. For Africa, we're seeing, I think, looking at more countries coming up with a national health insurance, more countries crowding in private sector, local private sector, international private sector investment to improve quality, to improve manufacturing, and improve really service delivery access to the most remote parts of their countries. Thank you.
Dr. Albush, we'll leave it there. Thank you very, very much indeed for giving us that update on the deliberations that took place this week. Thanks for your time.
Thank you for having me, and all the best to South Africa in this journey also.
Thank you. That's Dr. Omar Albush, Kenya's Director for Health Sector Coordination and International Affairs.